Welcome to Poultry Vet Doctor channel, where we dive into the fascinating world of poultry health, production, diseases, nutrition, and drug review. Poultry enthusiasts, today we are diving into a topic that's close to the bear's perspective: swollen eyes. How to identify and treat the 12 deadliest causes of swollen eyes in poultry. Join me on this illuminating journey as we uncover the causes and treatments for these puppy piffers in our feathered friends. Swollen eyes in poultry can be caused by various diseases or environmental factors. It's important to note that a definitive diagnosis should be made by a veterinarian through a thorough examination and possibly laboratory tests. Here are some of the potential causes of swollen eyes in poultry. First on our list is the notorious infectious coryza in poultry, which causes swollen eyes through its impact on the upper respiratory tract. The bacterium Haemophilus paragallinarum, which causes infectious coryza, induces inflammation in the nasal passages and sinuses extending to the eyes. The infection leads to facial swelling, including around the eyes. Timely veterinary intervention, along with appropriate antibiotic treatment, vaccination, and quick isolation of sick bears and biosecurity measures are crucial for managing infectious coryza. Minimizing the associated symptoms in poultry, including swollen eyes. Sometimes cleaning the eyes of isolated bears can also be of great help. Now moving on to chronic respiratory disease, CRD, caused by Mycoplasma gallisepticum, a subtle but impactful culprit that can lead to swollen eyes in your poultry. By affecting the respiratory tract, it leads to nasal discharges and sinus inflammation that can extend to the eyes. Eye tissues become irritated, causing conjunctivitis and edema around the eyes. Effective management involves antibiotics prescribed by a veterinarian, good biosecurity practices, and measures to enhance overall flock health, reducing its impacts and associated symptoms in poultry. Quick isolation of sick bears also help to manage its impact on the flock. The infamous Newcastle disease isn't just about paralysis, but can cause swollen eyes, as the virus can cause inflammation in the nasal passages and sinuses, which can extend to the eyes, resulting in edema, conjunctivitis, and swelling around the eyes. Vaccination, quarantine measures, quick isolation of sick bears, and strict biosecurity measures are key strategies for preventing and managing Newcastle disease outbreaks in poultry, reducing the likelihood of swollen eyes and associated complications. Infectious bronchitis, a familiar foe which impacts the eye health due to the virus targeting the eye tissues. The infection causes inflammation in the sinuses and nasal passages, extending to the eyes. Swollen sinuses and nasal congestion contribute to increased pressure around the eyes, resulting in edema. Effective treatment strategies to alleviate the discomfort for your bears involves antibiotics prescribed by a vet, biosecurity, vaccination, quarantine measures, and quick isolation of bears. Fowlpox, a viral intruder. It can cause swollen eyes in poultry as the virus affects the eye mucous membrane. The development of pock lesion around the eyes leads to inflammation and swelling. The presence of this lesion can obstruct the normal functioning of the eyes and contribute to discomfort. Antibiotics prescribed by a veterinarian, quarantine measures, quick isolation of sick bears, and vaccination, along with good biosecurity practices, are essential for preventing and managing fowlpox outbreaks in poultry, which reduces the likelihood of swollen eyes and associated symptoms. Avian influenza, a global concern. This viral heavyweight can affect eye health, resulting in ocular manifestation as the virus targets eye tissues. The infection leads to inflammation in the eyes, causing conjunctivitis and swelling. The viral impacts on the respiratory system, combined with systemic effects, contribute to the observed eye symptoms. Strict biosecurity measures, early detection, and appropriate management strategies are vital in controlling and preventing the spread of avian influenza in poultry. Panophthalmitis, a complex term for a serious eye condition linked to E. coli infection. This induces severe inflammation within the eye tissue. The infection can spread rapidly, affecting the entire eye, causing pain and swelling. E. coli's impact on ocular structures and surrounding tissue contribute to the observed edema. Timely veterinary intervention, along with antibiotic treatment, is crucial for addressing Panophthalmitis and in minimizing its impact on poultry health. Staphylococcal infection of the eye. This is not just a skin issue, but when the bacteria, such as Staphylococcus aureus, invade the eye tissue, it results in inflammation, which may spread to the sinuses. Additionally, the toxins produced by the bacteria may contribute to the irritation and swelling around the eyes. Treatment option for maintaining healthy pupils in your flock is supportive treatments, antibiotics prescribed by a veterinarian, biosecurity, vaccination, and proper movement control, and most importantly, quick isolation of sick birds. Sometimes it's the environment that plays a role. Environmental factors such as excessive dust, allergens, and high ammonia level in poultry settings can irritate the eyes of birds. This leads to inflammation and swelling of the eye. Poor ventilation may contribute to the accumulation of airborne particles, exacerbating the problem. These conditions can compromise the respiratory health and cause discomfort, manifesting as swollen eyes in poultry. Implementing effective ventilation system and maintaining a clean environment are essential to minimizing these environmental stresses and promote the well-being of the birds. Infectious laryngotracheitis, a viral nemesis which can cause swollen eyes as the virus primarily targets the respiratory ocular system. The infection leads to inflammation in the upper respiratory tract, including the eyes, which leads to conjunctivitis and swelling. The virus impacts the delicate tissues around the eyes. Vaccination and biosecurity practices are crucial for managing and mitigating the effects of infectious laryngotracheitis in poultry flock. Swollen head disease, a descriptive term in poultry, caused by viruses like Avian virus, can lead to swollen eyes. The viral infection induces inflammation in the sinuses and upper respiratory tract, extending to the tissues around the eyes. Edema and congestion in these areas result in the characteristic swollen eyes observed in affected birds. Proper biosecurity measures and vaccination are key components in preventing and managing swollen head disease in poultry. Sometimes it's not about infections. Rapid growth or the presence of abnormal lump in poultry can contribute to swollen eyes. Excessive weight gain can lead to increased pressure on the orbital region, causing eye swelling. Lumps, which could be abscesses or tumor, may directly affect the tissues around the eyes, resulting in inflammation and edema. Regular health check, appropriate nutrition, and prompt veterinary intervention are essential for managing such conditions and preventing eye-related issues in poultry. That concludes our exploration into the world of swollen eyes in poultry. Remember, a vigilant poultry keeper is a poultry hero. If you found this journey enlightening, hit that like button, share with your fellow flock keepers, subscribe for more avian adventures. Until the next time, may your coop be bright, your eyes clear, and your poultry pecking away happily. Stay clacky.